Why medication-assisted treatment, MAT, is the key to solving the opioid crisis. Hi everyone, my name is Audrey Knerk, and I'll be talking about one of the most urgent public health crises in the United States, the opioid epidemic, and more specifically about how the most effective treatment method we currently have, medication-assisted treatment, or MAT, is being severely underutilized. When I first began this project, I thought I was just researching addiction, but as I dove deeper, I realized that I was also researching injustice, and I was researching how stigma, policy, and systemic failure all intersect to block people from getting care that could save their lives. My research has made me think differently, not only about addiction, but about how society chooses who gets treated with compassion and who gets left behind. On the second slide, I talk about what the problem is. The core problem is opioid use disorder, or OUD, which is a chronic, potentially fatal condition. According to Hornberger, nearly 1 in 100 American adults currently have OUD, and yet an overwhelming majority of them, almost 90%, don't receive medication-assisted treatment. That's nearly 2 million people without access to a treatment that is backed by science and proven to work. And the consequences can be devastating. If we continue down the same path, Hornberger predicts close to 480,000 people could die from opioid overdoses in the next decade. These aren't just numbers, they're families, friends, people who might still be here if they had access to care. And yet we also know that expanding access to MAT and overdose reversal drugs like naloxone could prevent up to 179,000 of those deaths. That's nearly 40% of those lives saved. The crisis isn't just about the misuse of drugs, but it's about the pain, trauma, mental illness, poverty, lack of education, housing instability, and racism. It's about a broken healthcare system that often treats addiction as a moral failure instead of a medical condition. And that's what my project tries to explore, not just why MAT works, but why we aren't using it like we should and what needs to change. On the next slide, I talk about why I chose this topic. This topic matters to me for a lot of reasons. Personally, I've known people whose lives were touched by addiction, specifically opioid use disorder, and every time I hear someone say, why don't they just stop using drugs or something like that, it reminds me of how much misunderstanding still exists. Addiction isn't really a choice, it's a disease, and like other chronic diseases, it requires long-term evidence-based treatment. What really shocked me during my research was discovering how much stigma still exists, even among doctors. I expected the general public to hold outdated beliefs about addiction, but I didn't realize how deeply those beliefs were embedded in healthcare and policy too. This realization changed the entire direction of my paper. I started with a question about treatment and ended with a much larger question about how society decides who deserves to heal from their addictions. It made me think about equity, about how some people get early mental health care, access to education and support, and others are left to fend for themselves. For me, this project became about pushing back against the idea that people with OUD don't deserve care, or that MAT is cheating, or just replacing one drug with another. It's more about survival. Building on this slide about my perspective, I also want to talk about my argument. My central argument, or the thesis of this research paper, is that although medication-assisted treatment is the most effective and cost-efficient rehabilitation method for opioid use disorder, it remains drastically underused due to stigma, restrictive policies, and lack of integration into the primary healthcare system. And this underutilization is not just unfortunate, but deadly. This research project was divided into 4 parts. First, I explain what MAT is and how it works. Then I explore the barriers preventing access, things like stigma, system failures, and provider limitations. Next, I discuss opposing viewpoints, such as concerns about misuse and dependence, and explain why these concerns, while not entirely unfounded, are often misinformed. Finally, I'll end by showing how addressing these issues through education, reform, and compassion could transform the way we fight the opioid epidemic. My next slide is about what MAT is and why it works. MAT is a treatment approach for opioid use disorder that combines FDA-approved medications such as methadone, buprenorphine, and naltrexone with behavioral therapy and counseling. These medications work by stabilizing brain chemistry, reducing cravings and withdrawal symptoms, and helping people function normally again. And the thing is that MAT works. According to Timko et al., people who stay on MAT longer experience better mental health, stronger relationships, greater employment rates, and most importantly, fewer overdoses. In other words, MAT gives people their lives back and allows them to re-enter society as functioning people. One study by Justesane et al. Found that nearly half of the patients receiving MAT in a family clinic remained in treatment for over a year. That's huge because long-term engagement in care is what leads to real lasting change. And on top of all that, MAT is cost-effective. It saves money on ER visits, detox centers, and incarceration. It costs much less to help someone stay stable than to constantly respond to emergencies after they've already failed. So we have a treatment that's medically effective, psychologically supportive, and financially sound, and yet we don't use it as much as we should. And that brings me to the next section, which is the barriers to using medication-assisted treatment. The Committee on Medication-Assisted Treatment found that people with opioid use disorder are often seen as morally weak, irresponsible, or even dangerous, and that perception affects everything from healthcare access to housing to employment. Even more disturbing, Kennedy Hendricks et al. Found that people who had a family member with OUD often held more negative attitudes than the general public. Even those closest to the issue who should understand the struggle are sometimes the ones reinforcing shame and isolation. When that happens, how is someone supposed to feel safe enough to ask for help? And the stigma doesn't just target people, it targets the treatment itself. A lot of people still believe MAT is just replacing one drug with another, but that belief is scientifically inaccurate and deeply harmful. These medications do not get you high when taken as prescribed. They stabilize and save lives, but the stigma surrounding them makes providers hesitant to prescribe them and patients afraid to take them. Another barrier includes the healthcare system and how addiction care is often completely separated from primary care. A person might have to go to a special clinic that's miles away during specific hours with no transportation. And when you're already struggling with mental health or housing instability, all those little barriers can add up, and you might miss an appointment or can't get off work, and suddenly you're back at square one. That system fails people, and it makes tools inaccessible and makes it harder to treat addiction. Of course, not everyone agrees with using MAT. According to McGinty et al., nearly 1/3 of primary care doctors believe MAT is no more effective than non-medication-based treatments. Other concerns are about long-term dependence. Others worry about diversion, patients misusing or selling the medication. And again, these concerns aren't completely made up. Diversion can happen. Independence can be a challenge, but the thing is, the risks of untreated OUD are far greater than the risks of MAT. Critics of MAT often push for abstinence-based treatments, but the data shows that MAT drastically reduces overdose deaths and increases retention. For many people, abstinence alone doesn't work. OUD is a disease with a high relapse and mortality rate, and it needs to be well managed with MAT programs with oversight and behavioral health support. These benefits far outweigh the risks and save lives. In conclusion, we are in the middle of a national crisis, but we also have a solution that works most of the time. MAT is not perfect, but it is scientifically backed, life-saving, and cost-effective. And yet it continues to be ignored because of outdated beliefs, broken systems, policy issues, and deep-rooted stigma. This topic matters because people's lives are literally on the line. We wouldn't accept this kind of inaction for any other major health issue or chronic disease, and it should not be accepted here. Everyone deserves a second chance. Everyone deserves access to care, and if we can educate providers, reform our systems, and treat addiction with compassion instead of judgment, then we can begin to change the story of the opioid epidemic and help solve it. Thank you for listening.